Another common question that I'm asked is, what profile am I best suited for? And it's very individual. There's some anatomical considerations that I can pick up on physical exam when I'm able to evaluate a woman who is interested in breast augmentation. Generally speaking, the larger the implant, the more inclined I am to go with a higher profile implant, because the implants get very wide when it's a lower profile implant, and oftentimes too wide for the natural width of the existing breast. So the larger the implant, the higher the profile. There are three implants here with distinct profiles. This is a moderate profile implant. This is a full or high profile implant. And this is an extra full or extra high profile implant. You can see profile is measured from the flat surface upward. And each of these implants progressively has a higher profile. In addition, each of these implants, as you go, and these are all about the same size implant, they're about the same CCs, but they look quite different. The highest profile implant looks dramatically different than the moderate profile implant. And I'm going to also show you from above so you can see that the diameters are quite different. So now, as you can see, this is the moderate profile. Each of these, again, are approximately the same volume, a little over 400 cc's for each one. This is the moderate profile, this is the full profile, and this is the extra full profile. And you can see that the diameter is largest with the moderate profile and smallest with the extra full profile. So this has the highest profile, narrowest diameter, in between, and then moderate. There's also two other profiles that I never use, and they're called low profile implants because there just aren't any patients that I think are good candidates for them. How do I decide which profile is meant for any particular patient? Every woman has unique anatomy. The breasts are never exactly the same on one side versus the other. And an examination and measurements are taken in order to evaluate each person, each woman who is interested in breast augmentation. And there are circumstances where I would lead a person to a higher profile implant. For instance, a woman who has a wider overall breast but not a lot of projection would be an excellent candidate for a high profile implant in order to balance the width of the breast with enhanced projection. In addition, a woman who has mild sagging, not enough really to merit a breast lift, and that generally occurs in a woman who's had children and who is breastfed, where the skin is stretched and there's just a little bit of loss of fullness in the upper part of the breast. We call it deflated upper pole, and a little laxity of the skin. Well, a higher profile implant will also take up loose skin a little bit better than a moderate profile implant. So those are two circumstances where I would opt for a higher profile implant. In addition, some women come in who have dramatic asymmetries between the right and left side. Some of these are not completely correctable, but there are some things that we can do that will at least camouflage some of those asymmetries and make them closer to the same. And for instance, I might use a high profile implant on one side and a medium profile implant on the other if there's a chest wall asymmetry where one rib cage projects a little more than the other. So, and those things are determined after a good examination, measurements, and a careful conversation about what can be done and what the limitations of the procedure are as well.